All right, so for my patient with a flexor tendon injury, a laceration of all 8 tendons, and then injury to the median ulnar nerve, some manual techniques that I would perform would be initially, as I said in the therapeutic exercises that I would prescribe, I would help him with this one where I would do passive flexion and then have him do active extension with guidance from my hand for motion of those flexor tendons. So I would do that in my therapy session as part of my manual techniques. He did have a repair, so I would also do scar mobilization, soft tissue mobilization over the scar to prevent adhesions there as well. And then also control edema and later on down the rehabilitation process, use any modalities that I would see fit with my patient, depending on indications and contraindications at the time of through the healing phase and with my patient. And then also as the rehabilitation process would go on, and if they didn't have the proper range of motion in their fingers, I could do mobilizations as well. So the PA mobs on the MCP joint, PIP joint, and DIP joint to make their range of motion and flexion better, as well as at the wrist. So work on wrist range of motion and mobilizations there if needed as well. And so those are some of the manual techniques that I would perform initially, and then move on to more resistive strengthening and functional activities as the rehabilitation process goes on.